Hi, I'm Dr. Robert Moore at Awesome Chiropractic, and I want to talk with you today about how a whiplash accident, a car accident, will have a negative effect on the temporomandibular joint. So if you suffer from TMJD or TMD, temporomandibular joint disorder, this might be some information that would help you understand why you have a problem. The American Association for Dental Research said that in order to really diagnose temporomandibular joint dysfunction or any orofacial pain syndrome, that it's very important to have a thorough history and an examination, a thorough examination of the head and the neck. All right? In a whiplash car accident, what will happen is the head, because the head weighs more than your jaw, when you get hit, the force is going to move the head first and the jaw is going to stay. Same thing to the side, the head's going to move first, the jaw is going to stay. So that puts a lot of tension on the joint. And if you just think about it, the heavier object moves first, the lighter object follows. So it's kind of like a jerking motion on the temporomandibular joint. The Journal for Oral Rehabilitation says that patients with internal derangement of the temporomandibular joint were significantly associated with cervical spine disorders, even without the presence of subjective neck complaints, meaning 90% of the people did not even have neck complaints, but 90% of the time the temporomandibular joint was affected. All right? And so in this video, we'll show you a woman getting hit, and you'll see her head go back, but her jaw will stay in place. And that's a major problem.
First, we'll watch the impact at its actual speed. As we can see, the occupant is exposed to very rapid accelerations. In fact, in this collision of just 4 miles per hour, the occupant's head experienced 5 Gs of force, comparable to what a fighter pilot might experience, but without any protective equipment. And this is from a collision of about walking speed. Now, let's slow this crash down so that we can see the details of the occupant motion. As we can see in this video, the car is accelerated forward, pushing the pelvis and torso forward with the car seat. Since the occupant's head is not in contact with the car, it lags behind the body until it hits the head restraint. Finally, the head rebounds forward in the direction of the car's motion. Remember, this is a collision that took place at less than 4 miles per hour. Now, let's look at a collision just a bit faster, 6 miles per hour. First, we'll watch the crash from outside the car. We can see that the force is dramatically greater on the occupant in this collision. When we move inside the car, we can see that although the speed of the collision is just slightly faster than the first crash, the occupant forces are much more dramatic. When we slow down the crash test, we can see the same body motion as before, but the accelerations that the occupant experiences are much higher. In this crash test, the occupant experienced 9 Gs of force, almost twice that of a 4 mile per hour crash. So, though the speed only increased by 50%, the forces on the occupant doubled. To demonstrate how this can result in injury to the neck, let's look at it this way. The human head weighs about 10 pounds on average. When accelerated to 9 Gs, the human head effectively weighs 9 times its normal weight, or 90 pounds. And all of this occurs in just a fraction of a second.
So the position of the jaw and the head and neck are intricately related, and that's what the Journal of Manipulative Physiological Therapy says, is that acute symptoms, pain experienced during the initial treatment phase, is caused by the inability of the head and neck to adapt to the maxillary and mandibular changes. All right? So if you have a neck problem, the jaw is not going to sit on it properly. And if you just look in the mirror, and you might see head tilt, you may see your shoulder higher than the other. And that's one way to show that you have significant cervical aggravation with your temporomandibular joint dysfunction. I'm Dr. Robert Moore at Awesome Chiropractic. If you want more information about how a whiplash accident can affect the temporomandibular joint, call our office today, 810-225-7246. We'll be glad to help you out, and we hope you have an awesome day.